Welcome to NP Talk, developed by the Faith and Fortitude creators. Here, we will discuss topics particularly to build your knowledge and prepare you for your nurse practitioner exam.
Yes, whether it's through the AANP or ANCC exam. Listen in on our podcasters as they dive into various topics from pediatric health, women's health, down to assessments, diagnosis, and evaluation domains.
Please like, subscribe, and comment on our channel. Tell us what other topics you would like us to cover.
Happy learning!
Welcome back to the Deep Dive. We're the place you come to get those really dense, critical topics turned into, well, quick, structured knowledge.
Exactly, things you absolutely need to master.
And today, our mission is tackling the routine pediatric immunization schedule. I wanted to give you that exam-ready summary.
Yeah, we're aiming for real fluency here. The core series, the adolescent stuff, those sometimes tricky age and dose cutoffs.
We're pulling this all together based on current CDC recommendations.
Right, but it's crucial to remember always verify the latest schedule before you actually make clinical decisions. Recommendations can change.
Absolutely. But the foundational structure, the vaccine types, the general timing, that's the core knowledge we're building today.
Precisely. That structure is key.
Okay, let's unpack this, starting right at the very beginning. Birth.
Yep. First up is hepatitis B, Hep B.
Okay, Hep B, what type is that?
It's an inactivated recombinant vaccine, and it kicks off a 3-dose series.
3 doses.
Yeah.
And dose 1 is recommended. When?
Recommended right at birth. That's a good detail to lock down.
Okay, birth dose of Hep B. Got it. But the real bulk of the early vaccines comes later, right? The core infant series.
That's it. Clustered around those 2, 4, and 6-month visits. This is where the acronyms really start piling up.
Yeah, you've got DTaP, IPV, PCV, HIB, and rotavirus. It's a lot.
It is. Maybe we can group the injectables first. DTaP, IPV, PCV, HIB.
Good idea. What are the basics for those?
So these are generally inactivated or conjugate vaccines. They're starting off series that are mostly 4 or 5 doses long. They really anchor the whole childhood schedule.
Okay, let's take them off. DTaP.
Diphtheria, tetanus, and pertussis. It's an inactivated toxoids and subunit combination. Starts the 5-dose series.
5 doses. Okay, IPV.
Inactivated poliovirus vaccine. That one's inactivated, and it's a 4-dose series.
4 doses for polio, PCV.
Pneumococcal conjugate vaccine, also a conjugate type, also 4 doses.
And HIB, Haemophilus influenza type B.
Right, HIB is also conjugate, and usually a 4-dose series as well.
Now, I noticed the source material really flagged HIB. This one's important for exams. Why HIB specifically?
Yes. This is one of those high-value clinical pearls you just have to remember. The HIB vaccine prevents epiglottitis.
Epiglottitis, okay.
That connection, HIB, prevents epiglottitis. That's the absolute key takeaway for this vaccine. Seriously, lock that one down.
Got it. HIB prevents epiglottitis. Okay. Now, there's one more in that 2, 4, 6-month group, but it's different, right? Not an injection.
Exactly. That's rotavirus. The unique thing here is it's a live, attenuated oral vaccine. Little drops in the mouth.
Protects against bad stomach bugs, gastroenteritis.
Severe gastroenteritis, yeah. But here's a crucial variation you need to know. The dosing depends on the product used.
So,
if the clinic uses Rotarix, that's RV1, it's just a 2-dose series, given at 2 and 4 months.
2 doses. Rotarix.
But if they use Rotatech RV5, that one requires 3 doses, at 2, 4, and 6 months.
Okay. So the specific product changes the scheduling. RV1 is 2 doses, RV5 is 3.
Exactly. That choice matters for scheduling.
Okay, so that wraps up the main 2, 4, 6-month cluster. Moving on past 6 months, we hit the toddler stage, around 12 to 15 months.
Yeah. And this is a really interesting tipping point.
Why is that?
Well, you're getting boosters for some of those infant series, like HUB and PCV often get their final 4th dose here.
Okay, boosters.
But the big thing is we introduce the first doses of the major live attenuated vaccines.
Live vaccines, right? That's MMR and varicella.
Exactly. Measles, mumps, rubella, and varicella, which is chickenpox. Both live, both start here.
And these are both 2-dose series as well.
Correct. Dose 1 happens in this 12 to 15-month window. Dose 2 gets held off until school entry around 4 to 6 years old.
And I saw the sources mention combining them, MMRV.
Absolutely. That's a really common practice. To reduce the number of shots at the visit, many clinics use the combined MMRV product, MMR plus varicella, in one injection.
Makes sense. Fewer pokes are always better.
Definitely helps with adherence, too.
Okay, is there anything else starting around this 12-month mark?
Yes, the final core childhood vaccine gets introduced here, hepatitis A, Hep A.
Hep A, is that live too?
No, Hep A is an inactivated vaccine. It's given as a 2-dose series.
Okay, 2 doses. When do those happen?
Well, the first dose can start anytime between 12 and 23 months old. But here's the key rule you must remember for scheduling it.
What's that?
The 2 doses have to be spaced at least 6 months apart. Minimum 6 months between dose 1 and dose 2.
6-month interval for Hep A. Got it. Crucial detail.
Very true.
Okay, so that covers the big 12, 15-month visit. What's the next major milestone then?
The next big one is that 4 to 6 year visit. Think of it as the big school entry checkup and cleanup.
Cleanup. What needs finishing then?
This visit is really focused on getting those final booster doses in before school starts.
Okay, like which ones?
You're looking at the 5th and final DTaP-D dose, the final IPV booster dose, and importantly, the second doses of both MMR and varicella.
Ah, right. Finishing off those 2-dose series we started back at 12 months.
Exactly. If a child completes everything at this 4 to 6 year visit, they are essentially up to date on the core childhood series until they hit adolescence.
Okay, adolescence. That feels like a whole new chapter.
It really is. Transitioning around age 11 means new vaccines, yes, but also, critically, different formulations of vaccines they've had before.
Different formulations. Oh, you mean like DTaP versus Tdap?
Yeah.
The sources were practically yelling about this one.
They should be. This distinction is absolutely non-negotiable for exams. You have to know this, Gold.
Okay, break it down first. DTaP versus Tdap.
The simplest way I remember it, DTaP has the uppercase D and P, think big doses for little people. Infants and young children get DTaP.
Okay, DTaP for the little ones.
Tdap with the lowercase d and p is the adolescent and adult formulation. It's first given at age 11.
Age 11 is the switch point.
Precisely. It contains a reduced amount of the diphtheria and pertussis components. The main reason is to minimize those injection site reactions in older kids and adults who've already had 5 doses of DTaP.
Gotcha. Less reaction, same protection essentially. But that age 11 cutoff for the first Tdap is the key.
Absolutely critical. Age 11 means Tdap.
Okay. What else starts around age 11?
Huh.
Meningitis vaccines.
Yep. We initiate the meningococcal series then, and there are 2 different types to track.
2 types, okay.
First is MenAT-WY. That's a conjugate vaccine. It covers serogroups A, C, W, and Y. This is a 2-dose series.
2 doses for MenAT-WY.
When? First dose is usually given around 11 to 12 years old. Then a crucial booster is needed at age 16.
Okay, 11, 12, and then 16 for MenAC-WY. What's the other type?
The other is Men-B. This covers a different strain, serogroup B. It's a recombinant vaccine.
And when is Men-B given?
It's often recommended for older adolescents or young adults like those heading to college. It's typically a 2-dose series as well, but the exact timing can vary a bit more.
Right, so 2 different meningitis vaccines, MenAC-WY and Men-B, covering different strains.
Exactly.
Okay, and then there's the one vaccine whose schedule seems to cause the most confusion based on age.
Yeah.
HPV.
Ah, yes. Human papillomavirus vaccine. We typically use Gardasil 9 now, the 9-valent recombinant vaccine.
And what's the critical age cutoff here that everyone needs to know?
The magic number is 15. Age 15 years old determines the number of doses needed.
15. Okay, how does that work?
If the HPV series is started before the child's 15th birthday, say, you started at the 11 or 12-year visit. It's just a 2-dose series.
2 doses is started before 15. How far apart?
Those 2 doses need to be spaced at least 6 months apart, usually given at 0 and 6-12 months.
Okay. But what if they delay starting? What if they don't start until they're already 15 or older?
Then it immediately becomes a 3-dose series, no longer 2 doses.
Wow, okay, so that age 15 threshold is everything. Start before 15, it's 2 doses. Start at 15 or later, it's 3 doses.
That is absolutely the most critical piece of scheduling information for HPV. Nail that down, age 15.
Okay, got it. So that covers the core series and the adolescent editions. Let's think about practice logic now. Beyond this main schedule, what about annual things, like the flu shot?
Right, good point. The influenza vaccine, or flu shot, is recommended annually for basically everyone 6 months of age and older.
Everyone 6 months and up? Every year. Simple enough.
Well, mostly. There's a bit of complexity with the pediatric dosing, but only for their very first season getting the vaccine.
Ah, okay. What's the rule for first-timers?
If a child is under the age of 9 and it's the first time they've ever received a flu vaccine,
Under 9, first time ever.
they may need 2 doses that season, spaced at least 4 weeks apart, to build up adequate immunity.
2 doses the first year, if under 9. Okay.
After that initial season, or if they're 9 or older when they start, it's just 1 dose annually like everyone else.
Got it. And any safety things to remember with Flu vaccines in kids?
Yes, one big one. The live attenuated influenza vaccine, LEIV, which is the nasal spray.
A nasal spray flu vaccine, yeah?
It is contraindicated, meaning it should not be given to children under the age of 2.
Okay, no nasal spray flu vaccine for kids younger than 2. Important safety rule.
Very important.
Now, speaking of respiratory protection in infants, the sources also mentioned RSV immunization. But that's not actually a vaccine, is it?
That's a really crucial distinction to make, yes. RSV immunization isn't a traditional vaccine that stimulates the baby's own long-term immunity.
So what is it then?
It's passive immunization. It involves giving a monoclonal antibody. Think of it as giving pre-made defenders directly to the baby.
Okay, a monoclonal antibody, not a vaccine. Who gets it?
It's generally reserved for specific infant populations, typically those under 8 months old going into their first RSV season. And eligibility might also depend on whether the mother received the maternal RSV vaccine during pregnancy.
So it's targeted, depends on maternal vaccination too. Good to clarify, it's different from the routine vaccine schedule.
Exactly. Essential for protecting vulnerable infants, but it works differently.
Perfect. Okay, to try and tie all this together, maybe we can quickly map some key visits to the vaccines needed, like flashcard style.
Good idea. Let's try it.
2-month visit. What 5 vaccines are typically given?
Okay, 2 months. You're looking at DTaP, IPV, PCV, Hib, and rotavirus, the core 5.
Got it. How about the big toddler visit around 12 months?
12 months, okay. That's MMR dose 1, varicella dose 1, Hep A dose 1, plus potentially boosters for Hib and PCV if needed.
Right, the start of the live vaccines and Hep A. Okay, last one, the 11-year visit, the adolescent transition.
11 years, that's the Tdap switch, Tdap dose 1, MenA-CWY dose 1, and initiating the HPV series.
And because they're starting before 15, that HPV series is?
The 2-dose schedule at that age, exactly.
Well, that was a really fast run through a complex schedule. We went birth, infant series, toddler live vaccines, school entry boosters, adolescent changes.
It covers a lot of ground, but if you're studying this, maybe focusing on the absolute highest yield points for exams, we can boil it down.
Yeah, what are the top 3 must-knows from all this?
Okay, number 1, remember the Hib vaccine connection. Hib prevents epiglottitis. Know that association.
Hib prevents epiglottitis. Got it.
Number 2, the DTaP versus Tdap distinction. Nail down that Tdap. The adolescent adult formulation starts at age 11. That switch point is critical.
DTaP for little kids, Tdap from age 11 onwards. Okay, number 3.
Number 3 has to be the HPV dosing cutoff. Age 15 determines the schedule. Started before 15, it's 2 doses. Started at 15 or older, it's 3 doses.
Age 15 for HPV, 2 doses versus 3 doses. Perfect.
Those 3 points, Hib epiglottitis, DTaP, PTDAP at 11, and HPV at 15, those are absolutely fundamental.
And knowing those rules about the type of vaccine, the number of doses, those key age cutoffs, that really builds confidence for handling this in practice.
It absolutely does.
Well, thank you for taking this deep dive with us today. That was incredibly helpful.
My pleasure. And maybe just a final thought for you, the listener, to think about.
Yeah.
We've seen how much age determines the schedule, right?
Yeah.
DTaP is Tdap, the 2 versus 3 dose HPV rule. Think about how product-specific choices add another layer, like choosing Rotarix versus Rotatec changes the number of doses needed.
Ah, right. One less visit, potentially, if you use the 2-dose rotavirus option.
Or using the combined MMRV vaccine instead of separate MMR and varicella shots. It makes you realize how much clinicians might try to simplify things where they can because the course schedule itself has so many built-in rules based on age.
That's a great point. Simplifying adherence for parents is huge. So your next step maybe is practicing mapping those visit ages 2 months, 12 months, 4 years, 11 years, 16 years to the specific vaccines required. Get that flow down.
Exactly. Practice makes perfect.
Until next time on The Deep Dive.